Next, we'll discuss about the various forceps. First is the plain forceps. So what is typical about the plain forceps? That it doesn't have a tooth. This is not toothed. And since it is not toothed, it is used to hold conjunctiva as well as scleral flap or skin. And also it is used for holding the sutures while tying. Second, as we can see, it has small serrations at the ends. And these small serrations are helpful for holding the tissue. Next, we have superior rectus holding forceps. Superior rectus holding forceps is a single-toothed forceps. It is a single-toothed forceps. It has a S-shaped curve. As we can see, it has a S-shaped double curve near the tip. And this distance is 7.7 mm. Why is this distance 7.7 mm? When we use the superior rectus holding forceps to hold the superior rectus, when we keep it at the level of limbus, it is exactly 7.7 mm at the insertion of the superior rectus. So it is designed in such a way that this distance is 7.7 mm and we can directly catch the superior rectus muscle. Next, it is used to hold the superior rectus muscle to pass the bridal suture for fixing the eyeball during surgery, and it is also used for rotating the eyeball downwards in various surgeries. Next important is the limbs forceps. Limbs forceps is used to hold the cornea or sclera during suturing and intraocular surgeries. It is also a single-toothed forceps and it is fine-toothed forceps. The superior rectus one has a S-shaped curve. And first was the plain forceps, which is non-toothed with serrations. And this limbs forceps is fine-toothed forceps. So first is the limbs forceps. It is a fine forceps with fine tooth, and the superior rectus forceps has a S-shaped configuration, exactly 7.7 mm distance.